Tricuspid atresia is a rare congenital heart defect characterized by the absence or severe narrowing of the tricuspid valve. It affects the normal blood flow between the right atrium and the right ventricle, leading to complications in the heart's functioning and circulation. Understanding the embryological development of the heart, the anatomy and function of cardiac valves, as well as the hemodynamics involved in tricuspid atresia, is crucial for comprehending the pathophysiology and management of this condition. During embryogenesis, the heart forms through complex processes involving the folding and septation of the original tube-like structure. The primary heart field gives rise to the linear heart tube, which further develops into 4 chambers, 2 atria and 2 ventricles. Tricuspid atresia occurs when there is inadequate development of the right atrium, leading to obstruction or absence of the tricuspid valve. Various genetic and environmental factors can disrupt this normal development, resulting in the formation of tricuspid atresia. The tricuspid valve is located between the right atrium and the right ventricle. It consists of 3 leaflets or cusps: anterior, posterior, and septal. In a normal heart, this valve facilitates the one-way flow of blood from the right atrium to the right ventricle during diastole and prevents backflow during systole. In tricuspid atresia, the abnormal development or absence of this valve leads to significant hemodynamic disturbances and altered blood flow patterns. Tricuspid atresia disrupts blood flow between atria and ventricles. Systemic vein blood bypasses an underdeveloped right atrium and flows directly into the left atrium. This mixed blood is then pumped into the aorta, causing cyanosis, increased left ventricle workload, heart failure, and poor perfusion. Tricuspid atresia has different subtypes based on associated anomalies in blood flow. These include tricuspid atresia with normally related/transposed great arteries and double outlet right ventricles. Severity varies from mild to severe, depending on the degree of pulmonary stenosis and arterial hypertension, impacting management and surgery. Tricuspid atresia presents with cyanosis, heart murmurs, caused by abnormal blood flow and associated defects, and heart failure, from increased left ventricle workload and pulmonary congestion. Other symptoms include poor feeding, failure to thrive, and respiratory distress. Echocardiography is the primary imaging modality used to diagnose tricuspid atresia. It allows visualization of the cardiac structures, including the absence or obstruction of the tricuspid valve, the presence of associated defects, and the direction and extent of blood flow. Cardiac MRI provides detailed anatomical and functional information, aiding in the evaluation of the size and function of the ventricles, assessment of pulmonary artery anatomy, and determination of associated cardiac abnormalities. Angiography may be utilized to assess the coronary arteries and pulmonary vascular anatomy. Tricuspid atresia shares similarities with other congenital heart defects that involve the tricuspid valve or the right ventricle. Pulmonary atresia is characterized by complete occlusion of the pulmonary valve, leading to restricted pulmonary blood flow. Ebstein's anomaly refers to a malformation of the tricuspid valve, causing it to be displaced into the right ventricle and leading to right ventricular dysfunction. Differentiating tricuspid atresia from these conditions is crucial for accurate diagnosis and appropriate management. The management of tricuspid atresia involves a multidisciplinary approach, with tailored treatment plans based on the patient's specific anatomy and severity of the condition. Initially, surgical interventions focus on improving pulmonary blood flow through the creation of a systemic to pulmonary shunt, such as a Blalock-Taussig shunt or a modified Fontan procedure. Staged repair procedures, such as the bidirectional Glenn procedure and the Fontan procedure, aim to optimize circulatory dynamics. In cases of severe right ventricular dysfunction, heart transplantation may be considered as a definitive treatment option. The long-term outcomes for individuals with tricuspid atresia can vary depending on the severity of the condition, associated anomalies, and the effectiveness of surgical interventions. With appropriate medical management, including regular follow-up, monitoring, and intervention as needed, some patients can lead relatively normal lives. However, complications such as arrhythmias, pulmonary hypertension, and heart failure may arise in the long term, requiring ongoing medical care and intervention. Tricuspid atresia is thought to result from a combination of genetic and environmental factors. Genetic studies have identified mutations in various genes involved in cardiac development as potential contributors to the development of tricuspid atresia. Environmental factors, such as maternal infections, exposure to certain medications or toxins, and maternal drug or alcohol abuse, have also been implicated. Further understanding of these factors can facilitate genetic counseling and contribute to the development of preventive strategies. Tricuspid atresia is often associated with other congenital heart defects, further complicating the hemodynamic status of affected individuals. Atrial septal defects, ventricular septal defects, and patent ductus arteriosus are commonly observed in patients with tricuspid atresia. These additional anomalies affect the circulation and may require additional surgical interventions to optimize cardiac function and improve outcomes. In caring for patients with tricuspid atresia, we emphasize a comprehensive approach. This includes preoperative preparation, addressing psychosocial concerns, and educating families. Postoperative care involves monitoring, optimizing blood flow, managing complications, and providing counseling for patients and families. Tricuspid atresia is a complex heart defect requiring in-depth knowledge of embryology, anatomy, diagnostics, and management. Continual research and advancements can improve care and quality of life for those affected.